y'all, welcome to Queer Space with Jace. It's been a really long time since I've uploaded a video. I got top surgery on May 7th. This video is just gonna be like an update about top surgery and whatnot. I didn't do video vlogs like the days that I was healing, but I did write about it all. Like I did record like this is how I was feeling, this was my mobility, etc, etc. So I'm just gonna like share all that with you. So I am 1 month post-op from having double incision with Dr. Winnie Tong of San Francisco Kaiser. I'm gonna talk a little bit about pre-op stuff and then like instructions, and then I'm gonna talk about like the day of to my 1 month. Pre-op, your surgeon marks your chest with a surgical marker, and like for Kaiser, it's usually 4 to 7 days before your actual appointment. I had mine 4 days before, and then like 2 or 3 days before they're supposed to call you with your actual surgical arrival time. They do tell you that you're supposed to arrive 2 hours before, but they're like, you know, hospital fluidity changes, so here's a more accurate time. They showed us an enhanced recovery video. On the day of surgery, you're supposed to stop eating 8 hours before your arrival time, and then you're supposed to stop drinking non-clear liquids, so like milk or something, 2 hours before. They gave you a surgical kit which had Clear Fast in it, and Clear Fast is a clear drink that's supposed to help you feel nourished and full before and after surgery. It helps keep you from feeling like nauseous after surgery because anesthesia makes you feel nauseous, and then also makes you feel like less like disoriented and confused because of the anesthesia, and supposedly helps you with like constipation and whatnot. Then they give you 2 packages of antiseptic wipes. I was actually allergic to because my skin is sensitive as fuck. So I cleansed myself with it the night before, and they're like, if you have an allergic reaction, wipe it off. I kept getting this rash like on my body, like I had one on my stomach, I had one on my thigh, I had one on my arm. I was itchy from it. The day of, they were supposed to wipe me down with that same wash, and they're like, okay, we're gonna wipe you down with this, and I was like, I am actually allergic to that. I had an allergic reaction to it. There was these 2 nurses talking. There was the guy that was taking the notes on all my information, and then there's this female nurse, and she was like, well, if he's allergic to it, shouldn't we put it down on his allergies list? And then the guy nurse was like, no, well, he's not that severely allergic to it, so it's fine. Like, it's only like a few rashes here and there. In the operation room, they're also supposed to clean you with like the same cleanse. And I don't know if they actually did or didn't. I think they did because I woke up feeling like very itchy. And that was before they gave me medication, because like for medication they give you like oxy and I don't know, some other stuff. I was like, fuck that one nurse, because like I had like allergic reactions to it. I had like hives and shit, and I was like, dude, like I'm having an allergic reaction. Like, yeah, it's not that serious, but like if it's irritating my skin, that's like an allergic reaction. And if it's specifically because of that, like it's an allergic reaction. Once they give you your instructions, they give you a drawcord bag, like if you want to put your materials in it. So the day of, you're in the waiting room, and then they wait to call you into the room behind the waiting room, and then they prep you with like cleansing your body. You have to take all your jewelry, so I had to take out like my plugs and my nose ring, because you're supposed to take out your jewelry the day of. And they had to cleanse my nose with some yellow stuff that smelled like prunes. They also wiped my body with that, like my whole like upper torso with that. But they have you undress, and then they have you put on the patient robe with the back open. They have you put on these socks. They put like one of those space blankets over you, and then like there's a tube where it's like blowing in hot or warm air. And they brought me to the operation room, and I don't remember what song it was, but they're playing Fall Out Boy, okay? They're playing Fall Out Boy in the operation room. I was on the little gurney thing that they wheel me on. They have me transfer my body over to the operation table, and then they strap me down, one over my legs and then one over my upper body. And then they kind of like count down from 10, and then I just like passed out. I don't remember anything. I don't remember dreaming while I was under anesthetics. I woke up in that kind of doozy, but not confused per se. Apparently I slept for an hour after surgery, and then they gave me 2 popsicles, they gave me apple juice, they gave me water, they gave me crackers. Because they had the tube down my throat to help me breathe, when I woke up, my lower lip was numb, and it was really swollen for about 2 weeks post-op. The nurses said that I needed to wait 1 to 2 hours till I was more awake, and then to see if I could use the bathroom. So I was there from around 12:45 to 8:30 or 9 p.m. And then I didn't get home till like 10 p.m. because we live like an hour away from the city. So I actually decided to split the videos up from talking about pre-op and surgery the day of to my day of to 1 month surgery progress, because otherwise the video would be too long. So I hope some of that was helpful for y'all. Keep watching for updates. I'm gonna be posting more stuff about like my post-op surgery progress and whatnot. Thanks for watching.